floods which are raging through northwestern Pakistan.
11 years old, trapped under the rubble of a house.
Disaster in Asia.
There are still between 1 and 2 million people homeless.
One unit has become legendary, the Israeli medical unit.
The Israelis arrived here Friday night. By Saturday morning, they had set up a field hospital.
It's not really something that you used to see. A medical clown in a hospital somewhere that all of the people are soldiers and commanders. And it's become like a one unit.
There's doctors, nurses, there's paramedics, there's medics, there's clowns. We all work as one crew, one team.
We went from one child to another child to another child to another father to another mother. They were all in trauma.
When a person is in a state of trauma or distress or pain, they're usually either too immersed in the situation or they are detached. They are too much outside of themselves and they disassociate.
Before a few days they had a house, families, and now they don't have nothing. And we start to build something with them with a lot of tools from the theater and clowning and from the imagination.
There is something about the clown that really makes you connect in these situations where things are out of order, that this is the most out of order that it can get.
He or she or the group of clowns create what I call an island of resiliency, because around them, suddenly people who have been out of a crisis, disaster, suddenly there is a small island of laughter, play, and in that sense, they help that group to recreate what I call a sense of community.
The depths of the Indian Ocean have spawned a natural disaster enormous in scale.
Obviously, we came there sometime after the tsunami, so obviously we met with kids that lost not only their houses and their villages, but actually lost family members, parents, and thanks to the methods and the techniques of medical clowning, how they were able to play with this terrible disaster, how they were able to play with these hard memories and to turn them into a game and to turn them into something creative.
I'm standing at the entrance of the Barzilai Medical Center in Ashkelon. The fighting has been going on for 2 months. Ashkelon and the surrounding area have been targeted by dozens of rocket attacks. At the moment, there are more than 250 injured. The Barzilai Medical Center is situated only 12 kilometers from the border with Gaza Strip, which makes it the first referral hospital in case of an emergency for the entire area.
Most of the injured that arrived at our emergency room at that time of the war were under extreme stress.
They took a very major part in addressing the post-trauma children and adults.
זה לוקח להם כמה שניות, הם צורכים, הם בהיסטריה, אבל לאט לאט פתאום מסתכלים איזה איש משונה ככה עם אף אדום, ליצן, מה בדיוק, ואני מדבר איתם. לאט לאט פתאום הם משנים פאזה.
I think most of the time we were working spontaneously with what we know, and definitely helped the people who came, the injured, and the staff.
חמישה ליצנים רפואיים מישראל ניסו בכל זאת להעלות חיוך על פניהם של ילדים שנפגעו שם ברעידת האדמה וטופלו בבית החולים הישראלי בקטמנדו.
It is not just about being funny. The fun or the humor element sometimes helps people to put things in proportions. When you see yourself in a situation and you can laugh about it, then in order to do that you already have to take a step outside of the situation in order to laugh. So you disengage from the situation and you can see perspective.
כשאתה לוקח בחור בן 18 ששכב אצלנו במחלקה, הוא איבד את יד ימינו, ועומדים ליצנים סביבו, שרים לו שירים, ליצן פותח את המכנסיים, נותן לו ביד השמאלית שנותרה לו, כאשר הוא איבד את יד ימין והוא ימני, לעשות ניסיונות לזרוק את הכדור שייכנס לתוך מפתח המכנסיים של הליצן. זה שינה את היום לחולה הזה, זה שינה את הנכונות שלו לשיתוף פעולה עם הצוות הרפואי, שינה את מצב רוחו, את הקומוניקציה שלו עם אחותו שלא זזה ממיטתו, כך שזה שילוב מופלא בתוך ההליך הרפואי.
The Dream Doctors is striving to bring the natural qualities of clowning and medicine to a level that it will be a profession with methods, with theory, with practice, and with, I would say, academic horizon.